Welcome, everybody. Thanks for just a second there. We wanted to make sure we had everything ready and recording. So welcome to Virtual Headache School. I appreciate all of you being willing to join in online. And if you're viewing this later, you missed a great session with a robust group of people. My name is Pippitt. I am a family physician by training, and I have been a part of the headache clinic, seeing patients there for about 7 years now. Today, we're going to talk about non-pharmacologic approaches to headache, or maybe, the corollary question of this would be, I don't want to take medications. What else are my other options? I would prefer for this to be a little bit interactive. That's sometimes easier said than done over Zoom. So feel free to throw questions in the chat if it doesn't feel easy to interrupt me with a question at any point in time. And otherwise, let's spend the next little bit here talking about what some of our non-pharmacologic options are for treatment of migraine and headache in general. So first and foremost, I would say underpinning all headache treatment, whether you use medication or not, is lifestyle. So most people with headache and migraine know that there are some things that they do that actually can trigger more headaches or migraines. So sleep is a really big one. For me, I know that if I don't get enough sleep or I sleep sort of odd hours, that is a pretty consistent trigger for me for a migraine. So the importance of sleep is that you're getting regular hours, so regular go to sleep, regular wake up, and that you're getting adequate sleep. So everyone needs a little bit different sleep, so I wouldn't prescribe a certain number of hours, but make sure you're getting enough sleep that you wake up feeling relatively well rested. Too much sleep can also be a contributor to migraines. So again, just being consistent with your timing on that. Staying hydrated, another big trigger for me in my migraines is not drinking enough water that day. So that's something else I always enforce with patients to make sure that they're staying well hydrated throughout the day. That you're being active. Now, I'm not saying that I want anyone to be out running a marathon or doing CrossFit, but just that you're getting up and moving around. You're doing things every day. This is helpful for your overall health, both physical and emotional. And then making sure that you're not skipping meals. This is another big trigger for many migraineurs. So we typically will recommend that you're eating something, every 2 to 4 hours. You know your body best while awake, but definitely making sure that you're not skipping meals. I really wanted to make sure we started with those things because, as I said, these really underpin all of our treatment for migraine, pharmacologic or not. I often will tell patients that it doesn't, like, we can throw as many medicines at you as we can, but if you're not doing these things, then they're not really going to be very beneficial. So these are really important no matter what. So moving along to other options, behavioral treatment. So this would include things like biofeedback, relaxation, trying to respond to your body's signals as they come up to let you know you have a migraine, to see if you can sort of divert or keep the pain from building. Cognitive behavioral therapy, working with someone who uses that specific technique, same ideas. All of these have some good data behind them to support their benefits in treating headache. Acupuncture also really has some good data to support prevention of migraines. There's some question of, is it the action of doing something? So there was one study where they were trying to prove that acupuncture was better, and so they did sham acupuncture and then traditional Chinese acupuncture. So the sham acupuncture, they were still putting needles into someone, like in the process of acupuncture, but not using sort of the traditional following the meridians and the things that go along with Chinese acupuncture, but still showed a fair bit of benefit for migraines, also beneficial for tension headaches. One problem is this isn't always covered by insurance, but still can be a very great non-pharmacologic approach. I went ahead and included things like herbals and supplements because I know for some people this is considered non-pharmacologic, even though it still is a medication. I'm going to say medication in quotes that you're taking. There is some good data to support quite a few different herbals or supplements. things like feverfew, riboflavin, CoQ10, magnesium. All of these are options if you wanted to try something before going to a pharmacologic option. And then maybe a newer field that's emerging, at least for treatment of headache, although this idea has been around for a long time, is something called neuromodulation. Often people will think about these as the devices or things that we can use to sometimes stop the pain. But that's the whole idea of neuromodulation, is that you're trying to deliver some sort of stimulus, either via a chemical or through mechanical or electrical, and you're trying to disrupt a pathway that's already established to try to have less pain. So you might have heard about things like a spinal stimulator or something like that that's physically implanted in the body to try to reduce pain. That's something that sometimes people have heard of. There are a handful of different devices that are out there right now that have been cleared by the FDA, both for migraine, some also for cluster headache as well. Again, not all of these are covered by insurance, but still another thing, if you're not sure that you want to do medications and you want to know what other options are out there. So the first one I want to talk about is a device called the Cephalo. So this is a little something that goes on your forehead. Some older versions of this almost looked like a Wonder Woman headband that kind of went across the top of your forehead. And what this is an external trigeminal nerve stimulation device. So the trigeminal nerve is a big, complex cranial nerve that sort of does a lot of things for the face. And it's known that many migraines actually involve this nerve. That's where the pain is coming from. So the idea is using this neuromodulation theory that you can prevent migraines. That was the first one that came out, was actually just a prevention. So you wore this for 20 minutes a day. It's kind of a tingling sensation that you can adjust the intensity of that you wear for 20 minutes. The newer versions are actually a dual model, and so you can use it for prevention or for rescue. So both of those are available to you, although you could get the older model. It's a little bit cheaper if you just wanted to do the prevention first. So that's the first device I want to talk about. Again, I'm not trying to promote any specific product, but if you're interested in looking them up, there's a pretty good website, and they talk about how is it that work, show you what it looks like, and things like that. The next neuromodulator I want to talk about is a vagal nerve stimulator. So the vagus nerve is a very large cranial nerve that actually goes all the way down into your abdomen. And this has some FDA clearance. I'm going to talk about one device called the Gamma Core Sapphire, just because this is the one I have the most familiarity with, although there are a couple others out there. So what this is the vagus nerve kind of goes, can be accessed, I guess, through a sense, deep in the neck here. And what you do is you put this device against your neck. And again, two options here, one for prevention and one for rescue, that sort of have different prescriptions, if you will, for what to do. So for migraine prevention, it's 3 treatments a day for about 2 minutes. If you were doing for rescue, it would be a little bit different after that. And then this also has indication for cluster. It actually had an indication for cluster headache before it had an indication for migraine. And so this is another option. Thanks for your question. I'm just putting a little of these into the chat for you. So that first one, that's the Cephalo that I first talked about. It is spelled a little bit funny, so that probably is helpful to see it written down like that. And this one that I'm talking about right now is a vagal nerve stimulator called the Gamma Core Sapphire. The next type that I want to talk about, there's not a specific model out, but the idea is something called single pulse transcranial magnetic stimulation. This is being used for a couple different things out there right now, but specifically for headache, the idea is to do like a quick targeted magnetic pulse to sort of the back of your brain here to try to reduce pain or keep this from sort of going to a full-blown migraine. Sorry, I'm trying to talk and type at the same time, which I'm not very good at doing. So in one study of people, it actually helped with pain in just about 40% of the participants, but didn't actually help with other things like nausea or photophobia, but did help a lot with the pain. And there's another sort of similar idea of that, which is a remote electrical neuromodulation. And this is actually putting a band on your arm and sending weak electrical impulses to try to stop the migraine. So again, this whole idea of neuromodulation is really to just interrupt what's trying to get established in a full-blown migraine to keep you from getting one. And as with any treatment, I would say some of this is just trying to figure out what's going to work best for you and your situation, and what you're comfortable sort of trying. We have some of these in our clinic, up at the headache clinic, that we'll sometimes let patients try so they know. I put the Cephalo device on people, and within like 30 seconds, they were like, nope, not going to work, and take it off. So then they know that that's not something that they want to continue. The Cephalo device is one you buy outright. The company will actually let you send it back if you find that it's not effective after 60 days. So that's kind of nice. Price point is around $500 or so. So this is a nice option if you're not sure about it. The Gamma Core Sapphire, you actually have to buy sort of like a rechargeable code. That's the prescription, so that then you can fill it up for what you need to go from there. I don't actually have a sense of the cost for the transcranial magnetic stimulation or the remote electrical neuromodulation. Those aren't ones that I've had a lot of people ask about. I've seen them, but I can't tell you that I've prescribed them or used them for patients before with any of this. With a lot of these devices, you have to, yeah, thanks Susan. She put in that their Vivo is the armband brand. You might have some medical indications for reasons that you can or cannot use these. I would say, I was just double checking, do you need a prescription for all these anymore? I've given prescriptions for the Cephalo and Gamma Core. You definitely need one for the Gamma Core. When I was looking at the Cephalo today, there was something that said that you might not need a prescription for that anymore, but I would probably just get a prescription to be on the safe side. That might make it so that then you could use your health savings account or something like that to see if that would help defray the cost. So yeah, so Cephalo is now available without a prescription if you wanted to go that route on your own. What other questions do people have? I think for a lot of people, this is a nice option if you're not interested in doing a medication every day. Like I said, there are some medical conditions, if you have a pacemaker or other things, where these might not be the best choice for you, but they can be a nice choice if you've tried a lot of medications and they didn't work, or you've had a lot of side effects from medications. This can be another sort of option for you if you're interested that way. Let me just drop, I have a couple of links open to Cephalo and other things in here, so you could have dropped that in there sooner about how these things work, so you can kind of see their pictures and the other things that go along with that I think are kind of helpful to help give you some perspective of what it looks like, how big is it, things like that. The Gamma Core is kind of an interesting one. You put it on and you know that you're in the right spot when you actually get a little bit of lip droop, which is a little bit disconcerting when you see it happen. Our nurse sort of demonstrated that, and that's how you know that you're in the right spot and you're actually getting that. And we're happy to end the recording if that way you guys want to ask more specific questions that maybe you don't want that to be part of the recording. We're happy to do that if everyone is okay with that. Why don't we actually maybe just pause the recording